Hello, my name is Seo Hong-kwan. I am the president of the National Cancer Center Korea. Today, I'd like to present the National Cancer Control Program in Korea and how we achieved progress in controlling cancer in our country. The incidence rate of major cancer have been reduced over the last couple of decades. The decrease in the incidence of gastric cancer was associated with the changes in dietary habits, including reduction in salt intake and treatment of H. pylori infection. That of colon cancer was associated with the removal of polyps detected in screening by colonoscopy. And that of liver cancer and cervical cancer was associated with the implementation of immunization programs. The cancer incidence rate in Korea is now lower than the OECD average. In the past 20 years, the 5-year relative survival rate has rapidly increased from 43% in 1995 to 70% in 2015, which is similar to that in the US and higher than those of the UK and Japan. The National Cancer Control Plan was established and executed in Korea in 1996. The National Cancer Center in Korea has been developing and implementing the National Cancer Control Plan in collaboration with the government of South Korea. For cancer prevention, 10 action goals of cancer prevention have been published, announced, and advertised since 2006. As one of the cancer prevention projects, Korea has established a smoking cessation program for smokers. The smoking cessation support provided to smokers in Korea is the highest in the world. Nicotine replacement therapy, 3 months medication of varenicline and bupropion, and consultations are provided by 240 public health centers and 8,000 hospitals and clinics nationwide for free. 17 regional tobacco control centers also offer free 5 days residential smoking cessation camps. Similar to smoking, the group 1 carcinogen that Koreans consume is alcohol. Many are not aware that alcohol is a carcinogen. Therefore, we will provide the public with the awareness program informing that alcohol is a carcinogen and its consumption should be strongly discouraged for preventing cancer. The National Cancer Center developed a cancer screening guideline and implemented National Cancer Screening Program for 5 major cancers. The treatment outcomes of stomach, colon, breast, and cervical cancer have been substantially improved, and this is associated with early screening. Screening rate for the National Cancer Screening Program increased from 41% in 2011 to 60% in 2019. The out-of-pocket payment for cancer diagnosis and treatment is only 5% of the medical cost, and the overall coverage rate reaches almost 80% as the insurance coverage has continuously improved. National Cancer Center has been designated as the National Cancer Data Center, and we are continuing with the projects that comprehensively collect information on cancer-related lifestyle, cancer screening, treatment, and other cancer-related clinical data, which we will open for all researchers in Korea to their use. To improve the survival rate of cancer patients, strategic research for rare and incurable cancers, such as pancreatic cancer, is essential. To improve the survival rate of cancer patients, strategic research for rare and incurable cancers, such as pancreatic cancer, is essential, which will be discussed in the next session. The National Cancer Center has been promoting genome-wide association studies for early diagnosis of pancreatic cancer with the US NCI, and biliary tract cancer proteomics research through cooperation with the US NCI and Japan's NCC. And we are currently initiating a new nationwide research plan for rare and incurable cancers. The number of cases of rare cancers is very small at a national level, and the quantitative research can be improved by international collaboration. Thus, I suggest that we initiate international collaborative research. In conclusion, the National Cancer Control Plan will achieve a successful outcome when we focus not only on treatment, but also on the entire stage of cancer development, including prevention and screening. Thank you for your listening.